Thank you for staying with us on Channels Television. A warm welcome to Health Matters. I am Yomi Otaibi. 97% of Nigerians are exposed to it. It accounts for 60% outpatient visit to health facilities, 30% of childhood death, and 11% maternal death. I'm talking about malaria. Although malaria cases have dropped over the decades across the world, the disease remains a public health threat. On the show today, we'll be looking into how not just to prevent and treat malaria, but also how we all can contribute our quota towards the elimination of malaria vectors in our environment. My guest is the Lagos State Malaria Elimination Program Manager, Dr. Abimbola Oshinowo. Good to have you here.
Good afternoon, and thank you for having me.
Yeah, nice to have you here. Malaria, everybody says, malaria, come on, malaria. You know, why are you not at work? I had malaria. So because of malaria, you're not here. And so what impact is this having, you know, on the fight against malaria?
Malaria is not common as many people consider it to be. Malaria is a disease that is caused by what we call the malaria parasite, Plasmodium falciparum. That is a protozoan that is transmitted by the bites of an infected female Anopheles mosquito. Malaria is relatively common in this environment. We have a lot of mosquitoes here, so it can be transmitted to people based on from the bites of an infected Anopheles mosquito.
Okay, so we shouldn't commonize malaria.
We shouldn't.
It's a disease that should be taken seriously.
Yes, it is.
Okay, now let's talk more about how the environment plays a role in, you know, bringing about this vector that will come at the end of the day to transmit malaria to us.
Our environment is very malaria friendly, if I'm to put it that way. Malaria thrives very well in water bodies, which we have a lot of in this environment, particularly at the beginning of, because of the fact that we have a lot of rains in our environment. So we have puddles of water where Anopheles thrives. Mosquitoes they tend to live within water bodies, so they tend to lay their eggs within water bodies. So definitely,
if we have gutters like this, you know,
yes,
it's a veritable ground for.
Yes. Likewise, puddles of water around. When there's a flood, for instance, you have puddles here and there. They thrive. Mosquitoes thrive very well in those environments, and we have such we have such in this environment. So definitely, mosquitoes definitely thrive. They lay their eggs, and the eggs mature on to become adults. And once they become adults, the circle is all like vicious, and it starts all over again. So malaria is transmitted based on that, based on the fact that when mosquitoes bite an infected person, it transmits malaria to another person who may not have been infected, and gradually the cases increase. Okay,
so from the mosquito bite, to manifestation of the disease, what's the window like?
About 14 days. And then when the disease comes, the person comes up with fever, chills, the person starts to feel cold, the person can have headaches, can start to vomit. If it's severe, the person can become unconscious, and that is when we refer to it as severe malaria.
So the symptoms of malaria would be fever, you know,
yes,
and some of those ones you mentioned.
Yes.
But there's this other conditions that can also come along with these symptoms that you mentioned. So how do we make sure that this that we're talking about is malaria?
That is why it is important not to treat. Anytime you feel you have what is called malaria, you don't treat it, you do a proper diagnosis. And you will diagnose by either the malaria rapid diagnostic test kits or microscopy. So it's not just a situation where you're just popping in medicines and taking antimalarials because you feel it's malaria. Many other diseases present like malaria, like typhoid. If one has typhoid, some of the symptoms I've just mentioned, the person can develop it, can have it, and then it is assumed it's malaria. And the person starts to take drugs that isn't working. Meanwhile, you're not treating malaria. So it is important that a person gets properly diagnosed, either with a malaria, what we call RDT test, rapid diagnostic test kits, or with microscopy.
And that's one of the policy being pushed now, that you shouldn't just assume it is malaria just because there's a fever.
Yes.
You should get tested.
Yes.
And so, because we've seen that sometimes, because people just think this is malaria and then they go for anti-malaria. We have had, of course not in Nigeria, we've had cases of whereby people are developing resistance to malaria drugs.
Yes.
Tell us about that.
Malaria resistance happens when, a lot of times, when you don't take the drugs that are prescribed, and you don't even take them appropriately. For instance, you're told to take, you have what symptoms that are similar to what is called malaria, and then you start to take anti-malarials. The medicines don't work, and then you complain. What you have done is, some parasites may be within your quite right, which is not causing any clinical symptoms, and then those start to, get used to the drugs, and then when you do have the problem, it is not working. Likewise, you're not taking the drugs as appropriate. They tell you to take they tell you to take 2 tablets 2 times a day. You end up taking 1, or because you feel better, you stop taking your drugs. You can develop resistance to it, which is also part of the problems we have.
And we don't want resistance in
No,
Nigeria, because this artemisinin-based combination therapy is what is working for us.
Yes.
We'll still come to the issue of treatment, but let's talk more of those who are susceptible. I have said that 97% of Nigerians are exposed, but it would appear that some people are more susceptible.
Yes, the susceptible groups are basically children under 5 and pregnant women. Now, the reason being that is children's immunity they're still maturing. And they are not fully matured at that age. So definitely when they have the disease,